I'd like to invite on a few cause alumni who are currently shaping these solutions. First, Dr. Saro, who's Long Beach City Councilwoman for District 6. She's also a Cause Leadership Institute alum from 2016. And then Dr. Jasmeet Bains, who's chairwoman of the California Healthcare Workforce Policy Commission and Cause Leadership Institute alum from 2019. Welcome to you both. Thank you both for joining us today.
Thank you so much for having us.
Sure. I think we're going to start off by just asking you both to tell us about your journey to this position and what a few of the key factors were that led you there.
Sure. First of all, thank you for having us again. This cause has been monumental to a lot of leadership building for me personally. I think when I first came to cause in 2019, I was just appointed to the position of commissioner by Governor Brown, and then Secretary of Appointments going to Pascal Rogers. And I remember coming to the commission and wanting to do more, wanting to learn how to do more. I think a lot of people want to do a lot, but how do you do that? How do you get to a position where you're able to implement change? And how do you implement change? I think there's a lot of great ideas out there, amazing ideas, but how is it that you implement those ideas? How is it that you take accountability for those ideas and implement it in a way where you're able to make the impact that you are meant to make? And I think cause challenged that on me quite a bit. They put me in touch with thought-provoking leaders outside of my sector. I think as a physician, I've spent my whole life studying and in healthcare, and I, didn't have much experience in other aspects of, other areas. And I think cause really challenged me. And it challenged me to think outside of the healthcare field and see, yes, healthcare is important, but what are the economic impacts of our decisions that affect the healthcare of my patients as well? Because we can sit here and, continue to provide access to healthcare, but if a patient cannot get healthcare insurance because their corporation went under due to legislation, then what are we really doing? Can we really even help that person? So there's a lot of questions on the table, and it really challenged me. Right now, currently, I'm deployed to the Porterville ACS COVID-19 surge site that was put together by CalMet and the Emergency Medical Services Authority of California. And I'm honored for the opportunity to be here to see patients, to provide my skills at a time where it's critically needed. COVID-19 pandemic is something unlike anything we've ever seen before. And this year was very key to understanding the public health and health disparities that exist in our community, have existed. I think the biggest question from this year really is, what happened that made us shut down? What is it that happened? And really, if you look at it, we didn't have capacity for the number of people that were getting sick. And the question remains, why don't we have capacity? As a developed country, why don't we have capacity for all these people getting sick? For a healthcare system that's supposed to be in a developed country, why are we lacking? So cause really invoked that a lot in me, challenged my thinking. And I think that's where my journey began. And the key factors, of course, was thinking outside of the box and stepping outside your comfort zone.
So I, never thought I was going to run for office. I just got sworn in to Long Beach City Council to serve for District 6 seat. And I believe that it really is my life experiences, and I think just pursuit of, I think for me, having grown up in a community that's been through a genocide and it's grown up as a refugee, you know, knowing that my parents were always wondering where their family members were, you know, what were you going to do next? It was like this more than intense survival mode. There was this intense traumatic experience on top of trying to figure out how to resettle. And I think that, you know, my experience in having to be an advocate early on to help my parents and community navigate, in addition to also figuring out how to navigate school myself, really just develop all of these, I think, experience and passion to serve in the sense of helping others, knowing that we are all kind of lost in this community, in some sense of kind of how we're feeling even right now in this COVID pandemic, right? And so it's been a really driven by purpose, which is why I decided to run against a 13-year incumbent, right? My race definitely was not easy in that I wasn't an open seat. I ran against somebody who's even considered a legend, who's lived in the district for 75 years. And, you know, everyone's told me, you know, we just don't think you're going to win, you know, doubt on top of doubt. And being who I am is like, well, you know, I'm the one that knows myself. I know my ability, and I know how to run campaigns, having been a labor organizer, you know, and connecting and working and moving people from inaction to action. So I was able to get a lot of people who've never been in part of the civic engagement process to volunteer and to vote, and you know, not just Cambodians, but also Spanish speakers and others that are in our district. So I feel that it's really about not being afraid because you're not doing, you don't think you're doing the what's approved or not approved, or always needing approval. For me, it's just doing what's right for you. And that's what's right for me. Is I felt it was the right time. And I think that while it's an honor for me to become the first Cambodian American to serve in Long Beach, it's an honor to be able to be, I think, feel that I made the right decision in having won a race that was really tough. I mean, it was a large margin by 20%. So, so that's where, you know, how I got to this point, and the work's just beginning, as I think we all are feeling it now in the kind of second surge of this pandemic. So I'm honored to be here as a panelist, you know, with Dr. Jasmeet, and as well as I think with all of you all. Unfortunately can't see you, which is really strange because I feel like I'm talking to myself all the time in a virtual setting.
Thank you both for sharing. And I think also hearing both of your stories where your experience and expertise combined with what you were passionate about, also with timing and just taking that jump, but also taking it in a way that you knew the risk and you went for it. Dr. Saro, I was really appreciative of the way you shared that story. I know that the Cause Leadership Institute was part of both of your journeys. And I know, Dr. Bains, you shared a little bit about that already. So I'd like to start with Dr. Saro. Just tell us a little bit about how the Cause Leadership Institute was part of that journey, but also I think share maybe some advice for folks who are in that moment where they know that they have that expertise and they're kind of trying to decide what to do next in terms of their own public service.
I was part of the inaugural, I think, Political Institute back in 2016 when it just started. And that was also the time I was exploring. I was working for former State Senator Ricardo Lara at that time and had considered running. And so the Political Institute came at the right time, and where I wanted to explore the political field. I feel like every time I moved, I have a new job, I changed sector. I went from labor, nonprofit, and then I went into public service. And so it was a great time to meet and hear from guest speakers, as well as understand kind of a little bit of the nuts and bolts of running a campaign. So that was really helpful for me to be exposed to that, and also meet other participants who either were already in office and maybe thinking about moving into higher office. So it was helpful to have others going through a similar experience that I could speak with. And as far as I think advice is, I think I kind of shared it earlier, is really, you know yourself the best. You know what you're passionate about. Hopefully you continue to, if anything, find yourself through the exploration of the work you do. And then you keep following, I think, that process of figuring out what your passion and your purpose is. Sometimes it's not always clear, but I think it's always taking a chance whether or not you feel you'll succeed or not, whether or not your parents support you. I mean, let me tell you, every time I tell my parents I'm going to do something, they're just like, what? But then them being refugees, they're like, okay, well, do what you want. Just don't get arrested or don't get pregnant at that time, right? So I had that experience of just don't do all of these things that'll get you in a lot of trouble, but at the same time, was able to give me the freedom to explore it because I was an advocate for myself. So for everybody, I guess, even if you're still in, thinking about changing your career, it's like not too late if you've been in one sector for a long time. It's kind of the cause training or that allows you to kind of think about pivoting as well. So.
Thank you. Thank you for that. And then Dr. Bains, is there anything you want to add in terms of maybe add more to what you shared earlier?
I wanted to echo everything said prior. Absolutely. It's really about stepping outside of your comfort zone, and it's about learning who you are, what you represent, and the years and years of generations prior to you that have been fighting for you to have this moment, and honoring that by having that moment. And then also, thanking and having mentors along the way that can be there for you. I was blessed to have a few people that I was able to reach out to, Annie Lamb, Charlie Wu, thank you so much for creating Cause, of course, and then Justine, Nancy, all you guys at Cause. I think you guys really encourage and inspire a lot. And so a lot of this has to do with your guys' leadership as well.
No, thank you for that. And I think it's something I'm also experiencing with the network also, is just how interconnected it is in these moments, but also how willing everyone in the network is to just really have that phone call or have that touch point when somebody just has a question or wants to know a little bit more. So I feel like I'm also getting to know the network, and even though I know that, I continue to be surprised at how generous folks are with their time and their expertise. I'd love to hear a little bit for both of you. 2020 was both a big year, a challenging year. And just love to hear some reflections of 2020 from you and some of the memorable things that are shaping your plans for 2021.
Do you want to go first, Dr. Bains? I went first on the last one. I'll make sure we take turn.
So much to be said. That's such a loaded question. I think the pros and cons, most memorable about 2020 for me was seeing the adaptability of the world, really, right? We really came together to respond to a public health crisis, and we responded. It was amazing to see that adaptability, the resilience, the people, the stories of so many stories of people that, donated their time, got out of their comfort zones, and were there for others. There's so many stories outside of healthcare even as well. And I think, in continuing that fight, I would love to say COVID-19 is going away tomorrow, but it's not. I think we realize that, and continuing fighting for that, continuing fighting for equality. I think this year has opened our eyes to health disparities, racial disparities, and continue fighting for those disparities. In healthcare itself, I mean, I've been fighting for healthcare a very long time. I remember having a conversation with Charlie where I'm like, I just don't know. This is about a year ago. I said, I just don't know, how do I fight for healthcare? You know, there's so much going on. And he said, well, if you want to fight for it, you can't just be at the table. You have to be creating that menu at that table. And it really hit home for me when I was elected chair of the California Healthcare Workforce Policy Commission, because it really, you know, got me thinking that that's true. You can't just have these ideas. You got to figure out ways to implement them. How do you create equality and access to healthcare? In my little town of Taft, I was just trying to lead my community of Taft forward. I was seeing problems. I was seeing, you know, the health disparities that were happening in the socioeconomic world, the mental health problems. Why is it that there's so much substance abuse? Why is it that so many people are fighting mental health problems in America right now? Why is it that we have the highest maternal neonatal mortality rate? Why is it that caregivers have such a hard time taking care of end-of-life care decisions for their loved ones? Why is human trafficking a problem in America? And worst of all, why don't we have enough PPE? I mean, it's crazy the amount of things we've learned. And, you know, in a lot of ways, there was a mask that came on our faces, but a huge mask came off of our eyes, really, in 2020. And the dirty laundry of healthcare was aired out, because this is a problem that's been happening for years. For years, we've been seeing ICU capacity at max. Every winter, we've been seeing that. This year, it's worse than any other year, because now we have another pandemic on top of it. What's happening to those gunshot wounds? What's happening to those people that are having heart attacks? When we're having ICUs that are overwhelmed, are those people even getting the care? What's happening to people in recovery? What's happening to people with their mental health? So many questions that have to be answered in 2021, and so much work to be done. And so I'm honored to have the position that I have on the Workforce Policy Commission. We've been trying to increase healthcare workforce, which is something, how to utilize RNs, how to increase our RN workforce, how to utilize, you know, the RNs were the most impact. Our nurses are our true healthcare heroes of this year. They have been working day in, day out. And I really want to give, you know, a huge applause to our nurses that are working. Those are really their healthcare heroes this year, not me.
Okay, so I would say don't run a campaign during a pandemic. It was not a choice. You know, when the stay-at-home order occurred, it happened right after my primary ended, and then everyone was forced into, you know, the lockdown that we've all experienced. So, I mean, I think that this has been a jolt to the entire world about how much our lives can change drastically. And I think that it's been a lot about learning how to cope. And it's not something, I think, new to me or my community in the sense of having to deal with trauma, right? Of having gone through a genocide and resettlement. So for me, it's been, as I said, I've had conversations with all of the community members. It's like, it's just about, well, what's the frame of mental mind can we kind of really control for ourselves to manage through this challenging time? And some people do it humor. I do. I try, obviously that was my coping mechanism growing up. When things got heavy or challenging, it was always through humor. So I think that it's obviously we're having a lot of challenges, and you've asked a lot of great questions, Dr. Bains, and it's something we're going to be confronted with even beyond the pandemic, right? So it's always going to be great to ensure we're developing leaders and engaging people in the conversation. And I think that For me, it's always been that it's about how do we work with others. I find that many people have become much more generous. Obviously, we've seen the extremes, right? Those who just don't even do their part by wearing a mask. Um, and I think that it's really seeing how we can make sure that we really cultivate that spirit of generosity and kindness that exists. That's what I want to continue to do as a council member going into 2021 in our very daunting time. But I think that that's the spirit of what I want to make sure we keep encouraging people to do, is to check in with each other. You don't have to have money to help others. Give people a call. It's so easy to be isolated in this virtual world. And, it's just hearing about people committing suicide pretty often. It's with a range of age people. So I really think that if anything, it's just making sure to check in with people and check in yourself as we're going kind of into this new year. And that's the spirit that I'm going into, is, humor and generosity or just kindness by checking in with people. So that's really how I think I'm gonna go into 2021. And then somehow kicking COVID's butt along the way. I don't know, but we'll figure out how, right? We're doing it in every way we can.
Absolutely.
Yeah, thank you. I mean, both of you are just, you're asking a lot of questions, but also I think in listening to you both, I'm just really excited that you're both in the positions that you're in. I think it's a real asset to all of us that you're there, as well as just hearing some of the way you're perceiving not just the challenges ahead of us, but also knowing your involvement in our communities just also makes us feel like we're there with you. So I hope that that's how it feels. I'd love to end with maybe a short story about something sort of surprising and positive that you've experienced this year. As we kind of end our year as well, I thought I'd just ask you both if maybe you had one.
Something positive. This should be a lot easier to answer, right, in a time of COVID. But I mean, I think I have to say that the positive things in running this campaign is that in a pandemic time it was amazing that the support I felt like I had when I ran my primary campaign, it just shifted virtually. Like everybody got into formation in a way where it was just like a natural, okay, well, we'll just adapt to it and we'll raise money from whoever we need to. A lot of my donors were just grassroots people, so everyone was just still like, okay, well, we're going to try to do this and this and this. So I feel like that was the most positive thing, is just people being able to adapt and know that if we stay focused, we can still get things done. So that for me continues to still inspire me, and it sticks with me, and I'm still in the midst of processing all of it at the moment.
Yeah, I guess something very positive that I learned this year more than anything was my patience and TAF taught me a lot. Patience teach you things, and they helped grow me. And I realize that more and more, especially when I'm at the ACS site here, especially when I'm working day to day in Bakersfield. The stories of my patients, the experiences that they have angered me, have challenged me, have gotten me to a point to ask questions, because I see so much injustice that happens on this level. And I think being on the ground, on the front lines, working, I've seen a lot of injustices, and having that patient voice and representing those voices and those experiences is actually a huge honor for me, because I know not very many people see it the way that I do. When I encounter a patient, I don't see a patient as the person in front of me. I see them as a collective group of experiences. You know, they are who they are, whether they are addicted to drugs, whether they are lacking economic ways to see a doctor, whether they just got out of prison. They are who they are because of decisions that society has made. Along the way, there are decisions that they make as well. But the biggest positive thing is to learn how to accept someone for who they are and not judge them. And that's something I learned from my patients, and I will always be grateful for my time that I was in Taft. That's something that I miss. I miss my little town of Taft very much. But I hope that I can utilize the experiences and memories of what I learned there to help create better environment for them. And I just hope that, you know, their experiences are magnifold or are taken to a higher level. Those are my biggest wishes.
Thank you. Thank you both. And thank you both for joining us today. Really just loved having you here and seeing you, getting to know you a little bit better. And just thank you for all the work that you both do. And if there's any way that we can support you more, or if you ever need anything, please reach out. Thank you so much for being here.
Thank you guys. Thank you so much.